Good evening, everyone. I'd like to thank you for taking time out of your busy schedule and participating with us in our second neighborhood meeting for the Dominican Renovation and Parking Garage Project. My name is Deidre Hamilton, and I am the planning coordinator for this project. I have done many projects within Santa Cruz County and many for Dominican Hospital itself, and it is an honor to be part of this wonderful team. Let me just take a minute to explain to you what the purpose of the meeting tonight is. One purpose is obviously to explain what the project is. Now, some of you attended our first meeting, and this may be redundant for you, but it has been a year and a half, so you might need a little refresher. The second purpose is to let you know where we are in the process, because the first time that we did this, it was prior to our application submittal. And since then, we have been progressing through the county planning department process. So we will let you know where we are and what still is ahead of us. Now, I'd like to introduce you to the people who are going to be talking with you tonight. The first person is Dr. Nan Mekowitz. She is the president and CEO of Dominican Hospital. The second is Osa Amafua, who is the area manager for Dignity Health and the project manager for this particular project. Then there's Dudley Campbell with Divinity Group. He's the project architect, and he knows everything there is to know about this project. So I'm sure you'll have lots of questions for him later on. The fourth person in our group is Jeanette Ingalls Ramirez, and she is the COO of Dominican Hospital, and she can answer questions regarding the hospital's operations. So with that introduction, I'd like to reintroduce Dr. Mekowitz, who will talk to you about the hospital's mission. Dr. Mekowitz?
Thank you, Deidre, and thank you for this opportunity to share with everyone about this exciting project that is going to enhance not only our mission, but also our ability to take great care of patients. As many of you know, for almost 80 years now, Dominican Santa Cruz Hospital has been living our mission of caring for the members of the community of Santa Cruz, especially those who are poor and disenfranchised. This was our original mission as set forth by our founding sisters from Adrian, Michigan, and their leadership and guidance continues to this day. As the only full-service hospital with a busy emergency room staffed by 20 physician specialties and highly skilled employees, we have taken this mission seriously and provided access to care 24/7, 365. And this is what we do and what we're proud of. During this long tenure in Santa Cruz County, we've introduced many great advances. We had the very first MRI, and most recently, the very first Da Vinci robot. We've provided excellence in care for our premature babies in the community, as well as our cancer patients. And most recently, we've expanded our life-saving technologies in the ICU with our ECMO program and our cardiac care with non-invasive procedures. So I speak for the whole administration team, the sister sponsors, the board of directors, the 1,600 employees, and 450 doctors to say we are incredibly proud of the work that we've done, especially this past year. We cared for so many people in this community who were impacted by COVID-19 infections, and we also took care of our patients as well as each other as people were displaced from the wildfires. So it makes sense that we would embark on a new project to renovate and modernize our facility. It's an opportunity for us to bring more advancements to the community. And we're excited that not only are we going to be changing our rooms from semi-private to private, and our ORs will be enlarged and expanded, but also we will be addressing that ever-present parking challenge that those of you who have visited with us are very fully aware of. So tonight you're going to hear more about the project from people who know it even better than I. You're going to hear about the 3-level parking garage and how that's going to improve access to care here. And you're going to hear our enthusiasm for continuing our mission, our vision, our values, and making the sister sponsors who brought us to Santa Cruz proud. And with that, I'm going to turn it back to you, Deidre.
Thank you, Dr. Mekowitz. We really, really do depend a lot on Dominican Hospital, and I am so happy that you are here and taking on this mission. Our next speaker is going to be Osa Amafua, the Area Director for Dignity Health. Before he speaks, however, I want to remind people that if you do have questions, would you put them in the question and answer section at the bottom of your screen? We will be looking for those. And right after Osa speaks, we will be checking to see if there are any questions before the presentation of the project, and we'll look for them again after the presentation of the project. But you can put any question that you have at any point in the question and answer section, and we'll be sure to get back to you. With that, I'm going to turn it over to Osa Amafua. Osa?
Thank you, Deidre. So good evening again, ladies and gentlemen. Excuse me. And thanks again for taking some of your very valuable time today to participate in this very important meeting that we have to go through to present and talk to you about a project that's really dear and close to our heart currently, which is the structural seismic upgrade and modernization project over at Dominican Hospital in Santa Cruz. My name again is Osa Imufwa, and I'm an area manager for the Planning, Design, and Construction Group for our organization. My goal tonight is really to help shed just a little bit of light on why this project is of immense importance to Dominican Hospital and the community that we have so gladly served for 8 decades. So going as far back as 1941, like Dr. Nan just mentioned, when our Adrian Dominican sisters first arrived in Santa Cruz, providing healthcare services to the community has always been our main goal and objective. Commencing the old Sisters Hospital location back in 1941, and ultimately to our current Dominican Hospital location at Soquel back in 1971. A continuous relationship where we have so truly enjoyed with the community and really will like to continue to build upon that. So with that in mind, I'll probably like to just focus on 4 of the critical reasons for this project, if you will kindly allow me. I think first and foremost, there is a binding requirement from the state of California mandating significant seismic upgrades to all hospital facilities that will continue to provide acute care services beyond January 1st of 2030. A requirement that has obviously been the key driver for this project. Secondly, the main hospital building on Soquel, originally licensed in 1971-72, was done prior to the establishment of the current regulatory body for acute care hospitals in California, which is the Office of the Statewide Health Planning Division, or simply called OSHPAD, as most of you probably know. We ended up with quite a few double occupancy patient rooms in the hospital. And hence, at this point in time, we're deciding to really work on converting a lot of those double occupancy beds to singles, since we plan to have acute care services way past January 1st of 2030. And so this way we can ensure more of a complete privacy and definitely more effective clinical outcomes for all of our patients and fellow community members going way into the future. Thirdly, which we think is also very critical, is that the current operating rooms are fairly dated and landlocked within the existing hospital structure, making it extremely cost prohibitive to rebuild them in the current locations. Hence, the new addition to the hospital's footprint will also help us accommodate this 10 new operating rooms with state-of-the-art technology, obviously to take the place of the outdated and landlocked ones that we're currently functioning out of. Lastly, and fourthly, but definitely not the least, for all of you that are very familiar with the campus, the open space around the campus has really been completely consumed with on-grade parking. All of our cars are literally parked on grade. And so to better observe and accommodate some of the seismic upgrade and modernization project that we're going to be talking about tonight, obviously it was very clear that we needed a better site optimization strategy to make this happen. So hence the development of the 409 car parking garage, which really allows us to create that kind of a vacant chair that the new building can then be situated or built on. So those are really kind of the four key items. I know Dudley Campbell will probably shed a little bit more light on that, but we are very excited and very humbled and privileged, quite frankly, to be participating in this project and trying to move forward with the community again that we've served for over 8 decades, and we hope and really plan to continue to serve you all as long as we possibly can. So that really concludes my part of the presentation. There's a Q&A section like we talked about later on, and again, thanks very much for all of your support to this particular project. Thanks, and I'll hand it over to Deidre.
Thank you so much, Osa. There were a few questions that came in, and I think the next part of our presentation will address those questions. Dudley Campbell is going to be presenting the project, but let me just give you the questions, Dudley, and you can highlight those when you do go through your presentation. The first question was impacts on Mission Drive. How is the parking garage going to impact mainly parking along Mission Drive was the question, but I think more broadly, how is it going to impact people living on Mission Drive? And the next question had to do with if you're going to a doctor's appointment or picking up a prescription at the 4-story building, can you park in the parking garage and will it be free? And where is the parking going to happen during construction? Now, Dudley, I don't know if you'll answer the one about the doctor's appointment in the 4-story, but after your presentation, Jeanette might be able to answer that question for our audience member. So with that, I'll let Dudley get started, and we will have another question and answer period at the end of our presentation. So keep those questions and answers coming. Thank you. Dudley?
Thank you, Deidre. Waiting for my screen to pop up. Here it comes. Again, thanks everybody for taking time out of their evening to walk through this important project. As both Dr. Nan, Deidre, Osa have communicated, I won't go through I won't go through the same items they've talked about. What I'm going to do is just go through the plan for the hospital, where we're looking to address those 4 points that Osa talked about and how we're going to go about that, and show you where the work will take place on the campus. So first couple of views, I'm going to go through again just some renderings of the proposed modernization expansion that will take place. If you look at this view here, where my cursor is at is the existing hospital, the existing 2-story component here, and the existing single-story ED. We will tuck in the new 3-story addition into that open parking field that is right off the existing ED. This is again just a view from the parking directly across from what will be the new public emergency entry. Off of here, we will have limited parking for patients and visitors off of that entry. And again, the parking garage is in the foreground here that you can't see. Just a view from the parking field that is just to the north of the existing helipad. Trying to show here the vertical expression and the design that we've implemented on this building to essentially play off of the existing, I'll say, serrated exterior expression, which is based on the old 1960s, 70s building. This will be a new entry between the existing 2-story building and the new expansion here. That'll come off the parking. This will be predominantly for public and family members and part of the outpatient, or excuse me, not outpatient, but the surgery waiting area, which will be in this area over here once you enter the building. Just some conceptual elevations here that again were part of the entitlement package. Again, identifying heights and building materials. Again, looking to really complement what exists on campus right now and looking to, again, keep that expression that exists with this new building. And again, with the current layout and function that's going to occur on the interior of the space. So here's the overall site plan. Just to orient everybody, SoCal Drive here on the bottom, Paul Sweet Road here on the left or west, and Mission Drive here on the right or the east. The existing campus is here with the existing main entry here that will remain. We will not alter that in any way. So people will still come to the building the same way from a public standpoint as they currently do, if that's the way they prefer. Again, the new building will be nestled in here where the existing on-site parking is. This is the current emergency department. This will be the new emergency entry that we talked about for public. And this will be that north entry that will be for surgery waiting as well as some staff. This will be some revised parking. Right now, this is a open lot that's on-grade parking. We will look to revise that to provide some pedestrian connectivity between the parking garage to the new entry, as well as back to the 1595, or I always get this mixed up, the 4-story MOB that's here. Just so everybody can see the orange colored building, that's where the addition expansion will go. Okay, and then you can see the ED entry.
Now we can see it. Yeah.
And the other north entry that I talked about over there. Again, the parking that's between the garage and the new expansion, that is a current on-grade lot that will be, again, revamped into a new, some limited on-grade parking with vehicular connection points to the existing roadway network, that's internal circulation. We have the parking garage that's here in blue. That again is a 3-story garage, 409 cars with 2 access points, 1 access point internally into the existing vehicular circulation network, and then 1 access point out onto Mission Drive. This other yellow, or orange structure here just off of the garage is what we're calling our equipment yard, or I'll call it a central utility plant. That's where some of the mechanical and electrical equipment will be located that will support and serve the new building. We also have a number of existing and new bike parking spaces throughout the campus. The ones that are in red will be new. The ones in blue are existing. And we will be providing bike lockers or a locked bike storage area within the parking garage. I think somebody had asked that previously. Okay. From a vehicular circulation standpoint, the main thing I want to show here is, because again, I know there's been questions, the parking garage, which is number 4 here. We will have an access off of Mission Drive. That will be an ingress and egress access point. The egress will be signed only for right turn only. You will only be able to go out and go to the right on to Mission down to SoCal. So we will not be directing traffic north up into the neighborhood. We know that was a question, concern at our last neighborhood meeting, and we wanted to make sure we had a graphic to show that as well. There will be other vehicular traffic directed internally into the existing circulation network that exists on campus. Again, a majority of traffic will be coming in and out of the 2 access points, ingress, egress out of SoCal, as well as Paul Suite off of Dominican Way at the far north. Just advancing a slide, so bear with me. So this is getting into more of the detail with regards to what the building will be and what's in the building. Right now, this dark outlined area in black, this is the lower level plan, which we would call, I guess, I don't want to call it the basement level, but I'll call it the lower level. And this is just a small mechanical area with vertical circulation. And it's really a connection to the existing loading dock that already exists from a service standpoint. So all loading and everything that currently exists and how that comes into and out of the campus will remain as is with this project. As you get to the first floor, the main level of the hospital, again, the black outlined area is the new building. On the first floor, we will be doing the new surgical department. Currently, there are 9 operating rooms essentially in this red outlined area that also contains all of the code required support spaces back when that was built. So that is pre-op, which is where you come before you go into surgery, post-op when you're out of surgery, when you have recovery, as well as any of the doctor, nurse, staff support areas. This project will look to build a new surgical department and central sterile processing area that will contain 10 operating rooms. So it is an increase of 1 operating room, as well as new central sterile and support spaces. We will come back and renovate the existing surgery area, which is in the red outlined area, once this building is done and operating and seeing patients. And we'll redevelop that into a new pre-op and PACU area. Again, that's where you come prior to surgery and as recovery out when you're done with surgery. So that will be reutilized to again support the surgery department. This yellow area right below the new operating rooms between the emergency department. There you go. That will be the new ED walk-in entry. We are not looking to do any expansion of the emergency department as part of this program, at least not yet, unless something changes. But we will be adding a new ED walk-in area, which will also be utilized for additional waiting and public area. On the second floor, waiting for the slide to advance. Oop, oh, I pushed too soon. Sorry, it's going to go again. Let's go back. There we go. On the second floor, will be patient care beds. So again, the black outlined area will be a 30-bed medical surgical unit, which is just a common standard patient bed. Again, these will be private rooms. There will be one bed per room. Each room will have its own private toilet shower area. We'll have public waiting, which is the yellow up in the top corner of that, as well as vertical circulation for public. And then immediately down to the bottom of that floor, there will be service elevators that will service the staff and patient travel up and down from the services below. We will have a connection at this floor into the existing second floor of the north building. And then you can see here the red outlined areas, as Osa mentioned and Dr. Nan mentioned. Though the current configuration of the patient rooms are semi-private, which means there's 2 beds per room. What we will do is, once again, the new building is licensed and approved to see patients. We will then come back in this area and renovate those rooms to convert them to private patient rooms. Okay, so we'll again set those up so they are private patient rooms with 1 bed per room. One thing to note, this program we're adding, or we're building 60 patient rooms, private patient rooms, but we are converting the same like number of semi-private rooms. So there is no increase in capacity with regards to patient rooms. The licensed bed count that currently exists with the state will remain and not see an increase with this project. And again, as Osa mentioned, today's modern healthcare trends are again for private family patient room areas to again make sure that the patient as well as family and other loved ones can be in an environment that is as calming and private as possible for whatever the reason the person is in the hospital for. So again, current trends are not to do semi-private rooms. So again, this is part of the modernization of the facility. One thing before I talk about this slide, from an operating room standpoint, Osa mentioned that the current operating rooms are again not up to current standards. The current operating rooms are probably around 400 square feet apiece. The new operating rooms will be in excess of 600 to 650 square feet, which is really what's needed today based on all the equipment and technology that accompanies the doctors and nurses into the operating room for the various procedures, robotics, other types of things, as well as an increased number of staff that will participate in procedures. So requirements now are something for a larger space that will accommodate all those new technologies and new procedural requirements. This is an interior rendering of the waiting area on the patient floor. So again, people come off the elevators where you see the Hello Human Kindness sign, and then they could wait in these areas while their loved one is being transported back for maybe a procedure or something of that nature. This is a typical nurse station. This is where nurses, doctors, and other staff would gather to take care of patients and do recording, etc. This is an interior view of the new patient rooms. So this would be a view of the private patient room, single bed. This behind this door, this sliding door over here would be their private bathroom and shower, as well as each room obviously would have a view out to the exterior. Okay, looking at the parking garage here. Again, we talked earlier about it being a 3-level structure, 409 cars. You can see the footprint here with the 2 egress points, one being off of Mission with in and out other side, there you go. And then one being internal off and back into the internal circulation network. We have stairs at each corner of the building, as well as a elevator to get you up and down. And you can see here where we have van accessible parking, as well as the bike parking. I'll just run through this quick because this is just another level. And then again, the top level of the garage, again, is very similar. Just some views of the actual parking garage itself. And there are some renderings of this as well as the hospital building at further in the program here. So I'm just going to get through this. Perspective view of the parking garage. Again, this top view is a view looking at the internal ingress egress point and the stairs with the elevator tower there in the front of the view. And then the bottom view perspective too, this would be the ingress egress point that you see here off of Mission. One of the questions we had from the prior neighborhood meeting, I can't remember the resident's name, who lives north of the campus, up in the hills there, wanted to understand what she would be looking at after this project is completed. So as part of our entitlement package that was submitted to the county for review, we provided this image showing the top where the existing hospital is. And then once the new project is done, you can see a little bit of the existing or the new 3-story building. And this, I believe, was shared with the resident as well, just so that they can see that. This is just an overall site plan that we have some various images that are taken from around the campus. The red are, again, hospital focused images. The blue are parking garage focused images. So we'll just go through there. Again, this is a view looking at the new hospital expansion building. Similar view to what we've seen before, just elevated a little bit more in that north parking field. A view on Dominican Way looking back at the new ED entry, as well as the new end of the building where the patient units would be. A little bit further, similar view, but at more ground level. Just a different angle. From just above the parking garage, this is what you would see, something similar if you were on the top level of the parking garage, obviously elevated a little bit more, you would see that. Again, we talked about a new vehicular circulation area where the current on-grade parking is, that will again be drop-off areas for public entry to the ED and then immediate ingress into the parking garage from that point. So as you come in, drop your loved one off, they can either wait there. We have a beautifully landscaped, I'll say, garden area with seating, wait for you then to go in the garage, park, and come back and take you into the facility. This is again view looking to the south east. This is again where the red tree is. This is where the entry to the surgery waiting is, called what we call the north entry point. Again, just another view of the grade level. Just a direct on view of the view from, I'll call the education building, back to the new building. This shows a little bit more context of the new parking garage and the landscaping that will occur around the parking garage, really looking to do as much as we can to use landscaping as a tool to diffuse the exterior of the parking garage. And then you can see the new hospital expansion off in the background. View from the west up high, looking again back at the existing campus in the foreground here, and the 2-story building, the new expansion building, and then the parking garage back at the top of the page. And just another view again, kind of north, not necessarily up in the neighborhood, but again, elevated up, again, looking at the parking garage and how that would look with the existing building context that's already there on the properties. So view from Mission from the north as you come down from the neighborhood and drive by the garage. This is what you'd see. Would be on SoCal with Mission at the intersection. And again, you can see the parking garage there a little bit to the north. And a little bit more detailed view of the ingress egress point off of Mission. Another view of that. The next images here are images that were again requested as part of the entitlement review comments and packages, just to understand what we would see from the scenic corridor on Highway 1. How would the new buildings be seen on Highway 1 as part of the scenic corridor? So we did these images. Not really much to see. Again, this is not a very tall building. It is a very low building, keeping in context with the neighborhood and the surroundings. You will see a little bit of the existing hospital here and the new hospital, which is outlined in red and hatched. Again, there's existing structures there that will shield part of it. And then here. So again, not much to see from Highway 101. Construction schedule, we'll go over this briefly. I guess my guess is we'll have some questions about that here as well. Looking to start the design. The design is shown here in the green, both for the hospital, which is the top group of bars, and then the parking, which is the bottom 3 bars. Design is shown in green, looking to start the design effort basically in July of this year, with the hospital design taking approximately a year to complete. And then during that time frame, we will be going through our permitting and approvals through OSHPD, with construction starting at the beginning of Q2 of 2024. So that is April 1st of 2024. And this long bar here is essentially all the make ready work, any demo work that we have to do to get the site ready. Then the actual building itself, fit out of the building, with that completing at the end of Q1 of 2027. Once we're done with that, we turn the building over to the hospital and their team to then go through licensing. So those 2 purple boxes there, that's a licensing phase, which is roughly 6 months. At the end of that phase, which is the end of Q3 of 2027, the expansion building will be open and ready to see patients. Once that occurs, that bottom blue bar right below the purple bars, that's when we go back in and do the renovation, which is essentially 2 years to renovate the existing surgery department and convert the existing private or semi-private patient rooms to private patient rooms. Again, that's because we're back in an existing environment. It's a little bit more complicated to work in those environments, as well as handle patients and looking at room turnover. But again, that's the process for the parking garage, or not parking garage, excuse me, room conversions and renovation. The bars below that, the bottom 3 bars, the green bar again is permitting, or excuse me, design, I apologize, which is essentially will be complete mid first quarter of 2022. So roughly 7 to 8 months. We then will go into permitting with the County of Santa Cruz, looking to come out of permitting sometime Q2, Q3 of 2022. So roughly a year after we start. and then look to get the parking garage built again within a year time frame from start to finish. The parking garage will be done and finished before we will do any construction on the new building and the new hospital itself. So that will be done in place and operating before we do any of the hospital construction work. And with that, we're going to play a quick video animation that some of you might have seen with regards to, again, just some context of the hospital and the neighborhood and the community. So here it is. So with that, Deidre, do you want to say some closing stuff before we go to the questions?
Yes, so thank you very much for that, Dudley. And I just want to talk briefly about where we are in the process and what the next steps are, and then I will get to the questions that we've got below. If you still have some questions, it's not too late. Go ahead and put them in the question and answers. Right now, as I've indicated, we have submitted our application to the county. We have actually just completed the CEQA, the California Environmental Quality Act portion of the review. The public review for CEQA ended on April the 19th. So the next step will be to go to the Planning Commission. We will be going to the Planning Commission on May the 12th and hopefully on to the Board of Supervisors on June the 22nd. And of course, both of these are public meetings. They're both, I'm saying they're public, but they will be done via Zoom as they have been during the pandemic. But any comments or support or anything that you want to submit to either the Planning Commission or the Board of Supervisors, those are the dates of the hearing that you want to focus in on. Once that review process is finished, that's when Dudley's schedule that he indicated to you sort of kicks in. They will start preparing the construction drawings for the garage. We would have to, of course, apply for a building permit for that garage before the construction can start. And as he's indicated, we're hoping to get that underway next year. So with that, I do have some questions that I've seen and I've been taking notes on, some of which I think we've answered, but some of which I think will need further discussion. A lot of the questions are coming from folks that live on Mission. And there are a few that I think, Dudley, you may want to bring up the parking garage slide to better answer it. One has to do with the bike lane. Will the bike lane on Mission be affected by the right turn only from the parking garage onto Mission Drive? And then another, I'm going to kind of group these together because I think you can answer them that way more easily. Another has to do with access, is the access onto Mission Drive only? And I think you answered that, but you might want to point out that it isn't on Mission Drive only. The ingress is on Mission Drive, the egress, which is right turn only on Mission Drive, but they can also exit out through the hospital. And one person said a neighborly thing would be to make the parking garage more green, but that question came in before you showed the slides with the foliage that is being proposed for the garage. Another question about the parking garage is there's the light at Mission and Soquel, which the people living on Mission Drive feel is very impacted with people going to work in the mornings. And they're wanting to know how is the parking garage going to affect the signal light at that intersection.
To answer the question, there are two access points off of for the parking garage. Obviously, there's an ingress egress off of Mission, and then there's an ingress egress internal on the opposite end of the parking garage that will direct traffic back into the internal circulation network. And for some reason, my slides are not advancing. So I'll just use this one right now. And again, unfortunately, whoever was helping me with the cursor, can you please move the cursor to where that on the, that's the Mission ingress egress. And then on the opposite end, that's the internal ingress egress that will come out into the internal circulation network of the hospital. Okay, so there are two egress points into and out of the garage that again will look to help divide the traffic going in and out so it does not all egress or ingress off of Mission. Thank you. Because you can see that a little bit better there. Where again, that's the Mission ingress egress, and then at the opposite end would be the ingress egress to the internal network. Okay. The comment regarding the stoplight at SoCal and Mission, I can tell you as part of our transportation study that was done as part of the entitlement package, there was a lot of discussion and comments as with regards to our study related to how the traffic is going to come in and out, and then how do the street lights get sequenced along SoCal Drive. I believe, and Deidre, you may be able to help me on this, I believe there is a study that the county is undertaking or has undertaken on SoCal to look to do a sequencing of those lights to again help with traffic flow, both the flow on SoCal as well as the roads that feed into SoCal. So again, hopefully we'll address that problem. Again, that is something that they needed the numbers and the volumes that we were projected in our transportation report in order to help with whatever their study was. One of the other comments I saw there, Deidre, I don't think you mentioned it, was related to street parking on Mission. The intent with this garage is obviously to provide parking for the facility, as well as both staff and visitors. Right now, this garage, once the garage is added, we will have, I want to say, in excess of 100+ cars on the site than what is required by code. That, in my view, I'm not the traffic expert, but I would tell you, by having that additional capacity, that will again help alleviate any of that on-street parking that occurs on Mission, due to the current site not necessarily being able to handle that capacity. So the site will be overparked once that garage is done, and when the whole build out is completed. Deidre, did I miss anything else on parking?
Well, there's some other questions here. I'll just sort of go through some of them. The bike lane that the question was asking, they said that they're not concerned about a bike lane on Mission. They're concerned about the bike lane on Soquel. And if that person can let me know, I'm not really, because the parking garage obviously is on Mission, and we're not affecting the frontage along Soquel. So I'm not sure what that question is referring to. So if the person that entered that question could give me a little bit more clarity on that, that would be helpful. And
so I would just, if I could just answer that quickly.
sure.
Right now, the only thing we're looking to do on SoCal is we are going to be providing accessible pathway from the new ED walkway all the way down to the south to the SoCal area where the bus stop is. That right now is the work that we have, I'll say, that will affect SoCal. So if there's a bike lane there now or plans for one, that's something that that I don't think we're disturbing or looking to impact in any way with what this project is providing.
And this is Eliza that was asking that question, Dudley. She says, the plan describes a new right turn lane on Soquel where there is now a bike lane.
And I don't know if that was I'm not recalling that. I don't know if that was one of the comments that Deidre that we saw the other day from one of the initial study comments that seemed to be confusing us with a different project down the road.
I think so. We to be more pointed with the response to that, we are not proposing a right turn only onto Soquel.
No.
If you had gone to the county's website or talked to the planner, we did get a comment back on our initial study that was talking about a right turn onto Soquel, lane off of Soquel. But they had our property confused with another property down near the intersection of Soquel and 41st. So we are not proposing anything like that. There was another question about electric car charging stations in the parking garage, Dudley.
Yes, there will be a plan based on actually California regulations. We will be providing electric vehicle charging stations to meet those code requirements, whether they're in the garage or elsewhere on site. We will have some, I don't recall the exact number, but there will be some dispersed throughout the site.
Okay, and this other question, I think, Jeanette, this one is probably more something that you can answer. And it has to do with who is going to be able to use the parking garage. Will it be available for people who have doctor's appointments or picking up prescriptions? They're also asking if the parking is going to be free. And another person asked if the surrounding medical offices are going to be able to use the garage parking.
Sure, thank you, Deidre. There are no plans at this time to charge for our parking, just like our campus is open right now for that. The 4-story building, those current 44 spaces that are in the front of the building towards Soquel, they don't change. There's no change to those 44 spaces. And the 130 that are in the back that go to that building and are marked for patients will be in the parking garage. So those slots will be available to use. Our parking is open for all our users, our patients, our visitors, our physicians, our staff. We do plan that as they move into the parking garage closer to the hospital, that they will be off the campus, and people will stay off the streets and onto the campus. And we hope that this parking garage should be able to give us that ability to do that. I think I also saw a question about parking during the construction and where are we going to park staff. We have some parking available over in the cemetery area. We are looking at parking. We did not have anything definitive, but we are talking to a number of different places to be able to have staff park off site, and we will be moving them in. We don't have a final plan, but many areas that we are talking. So our parking is open as our campus is open today. Did I get all of those, Deidre?
I think you did hit on all of them. If there is a follow-up question to that, please feel free to put it in the question and answers as we're going through and answering these other questions. I did have a question regarding the construction parking, and perhaps Dudley, you can answer this one, and I can answer a portion of this. This person was saying that we had talked about using the Rittenhouse property, which is over on the corner of Soquel and Thurber, as a temporary parking lot during the construction. And I believe my understanding is that is not going to be used for temporary parking. Is that correct, Jeanette?
Yes, I believe that is correct. I do not have all the details of our temporary parking yet, but we will be working. We're working on that. We have over a year right now, so nothing is signed currently.
Okay, so, and I know we do have a agreement with the cemetery to provide construction parking over there. Dudley, did you have anything you wanted to say about that?
Yeah, the only thing I was saying, Kevin McKay from McCarthy, he can jump in here too. Again, right now, from a construction parking standpoint, some of the parking for construction workers will be both internal and external. I don't remember the exact numbers, and Kevin might be able to have them. Obviously, we've talked about the lot, the cemetery lot, and as that is a place, I believe we have a letter from them for that. But again, we have a year to look at where that is going to go and get more details. But Kevin, do you want to add anything?
Yeah, sure. Thanks, Dudley. Not to pile on too much. Obviously, with the garage construction, it's not a huge manpower driven job. For the most part, we're going to try to consolidate all the trade partner parking on the job site as best we can during construction to limit the offsite and the operational impacts on the campus. There are going to be days, mainly on the concrete pour days, early on with foundations and some of the early elevated deck pours, that we'll look to utilize some of the available offsite parking. But once we get the decks poured out and we have some space available on site, we'll bring all the trade partners back on site and really try to utilize the garage under construction the best we can to limit the offsite impacts and the parking demands, which are already kind of in high demand already. So.
Thank you, Kevin. Jeanette, we did get a comment that when you replied, you did not answer about the employees at Cypress Medical and the other surrounding medical office buildings, if the employees can use the garage.
So we expect that the garage will be utilized mostly by the campus. However, by pulling more cars into the parking garage, there will be open space on our campus. I don't know if that'll be in the garage or out of the garage, but there will be open parking, and we do expect that we will have others parking on our campus as well.
Okay. And I think that answered their question. If it didn't, go ahead and put another comment in. There was a question regarding the emergency room. Can the emergency room be expanded?
I mean, I'll go ahead and.
I can take
Okay, go ahead,
that. I think for the time being, that's not part of this project. But I think like every other part of the hospital, we're constantly looking at opportunities and looking at kind of our demands and project needs, and trying to assimilate those as quickly as we can as we go through each fiscal year. But on this particular project, I think because we're already taking so much on, the expansion of the ED was not made a part of this particular project.
Also, just to add to that though, by opening up the OR space, we are opening space that is adjacent to our ED. And so it gives us possibly some options in the future that we currently don't have right now.
Absolutely, yes.
Okay, thank you for that, Osa. I'm going to read this one and then let's see who wants to answer. It said, also, as long-term projections for the next 5+ years been considered how this permanent parking structure will impact vehicle traffic flow in the area as it relates to vehicle traffic and on-street parking? Last thing, we want to increase the traffic flow on Mission Street, or I think it's the last thing we don't want to do is increase the traffic flow on Mission Street residential neighborhood that doesn't achieve its goal of decreasing, alleviating on-street parking after 5 years. I'm not sure where the 5-year part comes in, but and someone else can jump in, but let me just say, right now there are, and Dudley, you can give me the exact number. There's about 200 and something parking spots that are existing on that lot. And we're proposing 409. So right there is going to be an increase in the number of parking spaces that is currently available. And as we've indicated, the parking garage will be up and built before any of the other portions of the project are done, which means that over the time when the construction of the facility or the renovation of the facility is going on, that parking garage will be in use. In addition, as we've indicated, yes, there will be parking that would be required for the construction workers. And we are going to be providing off-site parking for those construction workers. That is not going to be happening on Mission Drive. So does anyone else want to jump in and address that question?
So I'll just say, yes, there are currently 200, just over 200 spaces on that lot where the parking garage goes. I think the question related to the 5+ years that you just had started with previously relates to, I think, the duration of the project and understanding if over the duration of the construction of the project, how has anything been forecasted to address that. And again, our parking study or traffic study that was submitted looked at the project in the state when it is complete and functioning. So when you look at that, the data that's shown there is based on a complete state of the project.
Okay, and there was another question related to parking, and the question was, did we do a study to understand if additional parking garage is going to alleviate on-street parking for residents on Mission Drive? And the answer is yes, we did include the parking garage and its effects on parking or lack thereof on Mission Drive, as well as within the hospital campus itself. So the conclusion of that study was that the Mission Drive residents should really see an improvement on people parking all up and down Mission Street in front of their houses, what have you. Because like I said, we're going to be providing over 200 additional parking spaces. So I think that answers that. Dudley, there was one other question. Are there going to be improvements to Mission Drive? Talking about the street itself.
Right now, the improvements that we have planned for Mission Drive are, again, just the ingress egress point that's going to occur there, as well as anything, I would say, within the footprint of that parcel that would be affected during the construction. I saw one of the comments about, are we going to improve sidewalks and things like that? Obviously, whatever we impact and touch during construction will be improved, but right now, there's not a plan to extend that beyond that footprint and that frontage, I'll call it.
Okay, thank you.
Sure.
There was a question. It says your traffic study did not include the big development going on Mission by Dominican Way. I think they are referring to, there's a 21 unit project, a residential unit project that has been approved by the Planning Commission that is going to be constructed on Mission Street in close proximity to the parking garage, but on the other side. In addition to that, I should just say, over on Soquel, the CVS project is also going to be going in. It has also been approved. They have not applied for their building permit, but I'm sure they will be soon. So there will be development going on there as well. And as I'm sure most of you are aware, Kaiser has submitted an application to put in a medical offices, medical clinic a little bit further down from Dominican, but it is another project that is anticipated. Right now, they have to have an environmental impact report done. That has not been completed, so their project is a little bit further off. I don't believe that Sutter has any plans submitted to the county for the drive-in property. I'm not sure what Sutter's plans are for that or what their timeline is or anything like that. But I just want to let you know that we are aware of all of these projects that are going on, and as is the county, of course. So when we look at traffic impacts, or when our traffic engineer and the county, more particularly traffic engineer, looks at all of the various projects that are coming into them, they do take those into consideration. And as a project comes in, if there's another project that comes in after it, then that project has to also look at the impacts of what has already been studied and approved by the county. So yes, our traffic study did take into account the CVS project. At the time, the subdivision traffic study was not part of our purview to look at. It wasn't one of the studies that we were given to look at. However, I know that the county did look at that as part of their review of our traffic study. So I think that your question, I'm not sure if there is a question there. I think your question is really all of this development going on Mission. How is that going to impact traffic on Mission? And I will say from Dominican standpoint, I can't speak for the housing project across the street, but our traffic study has determined that there will be a negligible increase in the number of patients, because what we're really doing here is upgrading the building. So where we had semi-private rooms, they'll be private, but we're not increasing the number of beds. There'll be a negligible increase in the number of employees because there's, maybe, another janitor or whatever that may be needed, but we're not increasing the number of employees based on this renovation. So what we're trying to do is modernize, not to try to, expand beyond what we're already licensed to do. So I would say, if anything, from the Dominican side, the traffic and the impacts on the neighborhood, the residential part of the neighborhood, you should see a improvement, definitely with that parking garage going in. And I hope that I've answered that question. If not, you can always let me know.
And again, I think you hit on a key point that I apologize, I should have explained a little bit more. Again, even though you see a new building being built on the campus, it's really all about modernization, as OSA and Dr. Nan communicated. It's again taking those semi-private rooms, making them private, and then taking the second bed in those semi-private rooms, and then essentially putting it in the new building. So while we show that there are 60 med-surg beds in the new building, again, that's being offset by the semi-private rooms in the existing building going private. Again, the license that's on file with the state is 222 licensed beds. That will not change. That is the driver, basically, that creates the traffic and the staff and whatnot, the number of beds that are in the facility. So that number is staying the same. So when Deidre says there's a negligible impact to the parking and or transportation that is already using the street network by the hospital, that's again what our traffic and transportation study has shown. And again, the facility cannot increase that number of licensed beds with the program we have here. There are certain regulations within the state of California that if you increase that licensed bed count from the 222, there are other existing services in the building that would need to expand and grow to handle that additional capacity, and that is not part of this program. So again, that's a key thing, I think, to understand, that the licensed bed count does not change.
Okay, there is another question here, and I'm gonna speak to this a little bit, Jeanette, but this has to do with 1662 and 1668 Dominican Way, those medical office buildings. The first question was, can those people park in the lot? And I think you've answered that. The answer is anyone, the parking lot is open to anyone. So if someone is going to park there and go into one of those buildings, there's not going to be a Gestapo type person, checking to see where you're going. But I want to add, and Jeanette, you correct me if I'm misspeaking. Our primary goal here is to serve our patients, doctors, the visitors that come to visit the patients, and the employees of the hospital. That's our first charge. But we understand that there is an impact on parking in the neighborhood, and Dominican definitely wants to be a good neighbor. And because of that, the garage is going to be open. Now, if everyone starts parking at the parking garage to the extent that patients and employees of the hospital can't get in there, then there are going to have to be some restrictions placed on it. I mean, that's just common sense. But our efforts are to alleviate the parking problems that exist in the neighborhood now. And I think that if people are reasonable about this, I think that everyone will be able to benefit from it. Now, Jeanette, you can correct me.
No, nicely said. Thank you, Deidre.
So the other part of the question was, is there going to be an easement between 1662 and 1668? And I think what they're asking is some sort of a parking indenture like you have with the 4-story building.
So currently, I do not believe we have any kind of an agreement with the 1662 or 1668. The 4-story building does pay for its own parking and the parking that it currently has and will use in the garage as well. So we do not have that established at this point.
Okay. Let's see, while the garage is under construction, where were the 200+ employees and visitors of Dominican Park? You didn't answer that.
I think I wanted to refer to definitely we're looking at offsite parking that our employees will be able to park. Our visitors, our patients, our physicians, we intend to have park on site. And we do intend to have some of our employees be shuttled in. We don't have final place or agreements in place right now, so I can't speak to those specifically, but that is our intention.
Okay. Has a nighttime lighting study for Mission Drive neighborhood been done? And I don't think that has been done, Dudley, but I think all of our lighting is dark sky lighting. Am I correct on that?
Right. Night sky type. We did do a photometric study as part of the parking garage package that went into the county to again show the lighting levels with the lighting, particularly on top of the parking garage, and again any of the spill of that onto the surrounding. Again, we're looking to shield the lighting as well as use dark sky type lighting techniques.
Okay. This next question, well, it's kind of more of a statement. It says Mission Drive residents need permit parking. Well, you've got to take that one up with Public Works and your Board of Supervisor. So that's not something that we control or actually have any input on. During construction, will that back parking lot, which shares the entrance of the current parking lot, be closed?
So I'm not sure if you mean the parking lot that's right behind the 4-story building.
I think his next thing, he says the parking lot for Dominican Plaza Pharmacy. So that's by the 4-story building.
So right now, and Kevin, you can correct me if I'm wrong, but during the construction of the parking garage, that parking area would not be shut down completely. There might be some minor impacts to that just due to construction, areas that need to be contained, I'll call it. But that would not be really addressed until the garage is done and we start working on the actual new building.
Okay, I hope that answered that question. How will the parking structure resolve issues of excess of hospital employees parking along Mission Drive residential parking? So
I think we kind of answered that one previously.
Yeah, I think we did, but I think what they're really asking is, how are we going to prevent anybody from using the street to park on? And the answer is, we are not the police. So if somebody parks in front of your house it's a public street. There is nothing to prevent that. If that is, that's, I think, why you were asking the question about your need for parking permits. That is something that you would have to take up with the county. As long as it's a public street and there's no restrictions, you know, like no parking or parking by permit only, there is nothing that we can do to prevent somebody from parking on the street. I will say, however, that parking in the parking garage is a much more convenient alternative than parking in front of someone's house that's further away from the hospital. So I think just by the fact that it is in closer proximity, and you're not circling the parking lot like you do now, trying to find a spot, that will encourage people to use the parking garage rather than parking in front of the residential area. But can we prevent it? No, we cannot.
I would just like to jump in if possible. So we are very sensitive to the fact that employees do park on Mission Drive and cause disruption to the neighborhood. And we have a lot of initiatives that are in place that we will be expanding, especially when we have the parking garage. So the employees will be incentivized to use the parking garage. They will have parking passes to use the parking garage. They won't have to spend their time looking for spaces. And we anticipate that will offload the street. So there wouldn't be a reason for Dominican Hospital employees to be parking and disrupting the neighborhood. That said, we don't have an opportunity and a way to prevent the surrounding medical offices from having their employees park there. And because of certain constraints with Stark laws and other issues, we will have to engage in conversation and some sort of work with our surrounding doctors' offices to formalize a deal that allows them to have employees use the parking garage. But that is something we'll have to do offline with them. But we do have a lot of meetings with our staff. We have newsletters. And once we have a good parking solution for them, we can really reinforce using that. We're also reinforcing, carpooling, biking, using the bus as appropriate. As you can imagine, it's hard for our employees to necessarily take the bus just because of the way that our different shifts start and stop. But even with that, we have some solutions that we've been trying to engage the staff in to make that something that can be usable for them. So we are aware, and we do think the parking garage is going to help us to address that very important issue.
And Dr. Nam, while I've got you there, this next question, you might be able to interject a comment as well. It says, the people that park and block have told us that they've been told not to park on the Dominican campus.
So at this time, I believe we have been encouraging our employees to park in designated areas. There has been some laxity more recently because of the pandemic. We haven't had as much traffic on campus, and we are reining everyone back in to go into their normal parking spots. The surrounding offices do not have guaranteed parking for their employees on our campus. So I believe that is presenting a bit of a challenge. That's a long-standing issue and probably a story for a whole other conversation because the solutions are not going to be easy on that.
Okay, thank you, Doctor. There was one last question. If anyone has another question, I'm going to answer this one. I don't see any other ones. So I'm assuming that we are getting to the end of the line, which is perfect because we are trying to end at 7:30. But this last question says, when is the estimated completion date for the parking garage? And I think Dudley addressed that. The start date, well, obviously it's going to depend on when we can get the building permit, but anticipated, I think he said April of 2022, and it's going to take about 12 months to complete. So that would put it in the spring of 2023.
It's roughly second, third quarter of 2023. based on what I showed earlier on the screen.
Okay. And this last comment says the tax-paying residents of Mission Drive and neighboring streets have been heavily affected by the parking of the doctor's offices, Dominican employees, and visiting patients. These individuals have moved trash cans from the street to park, damaged vehicles, blocked driveways. I hear your frustration. I think the project that we presented will help tremendously with this problem. I will not say that it's going to be 100% better, but we are making a very, very valid effort to do what we can to improve the situation. We cannot speak for the other medical offices that we have no control over, but from the hospital standpoint, we're going to do quite a bit. And I think that's probably a good note to end on. I want to thank you again for your participation. If I haven't been able to get to your question or answer your question more fully, please feel free to email me. My first name is spelled Deidre, and my email address is deidre@hamiltonlandplanning.com. Or you can talk to Nate Macbeth, who's our planner. His email address is Nathan, Nathan .Macbeth, and that's MACBETH @SantaCruzCounty.us. So if I can't answer your questions, I'm sure he can. If there are any other comments that you want to make and I can't answer them, I will find someone on the team that will be able to get back to you. Thank you, everyone. It's been a great evening, and I hope you've learned a lot about the project and we've been able to answer all of your questions. Good night.